Which anticoagulant is used for CBC? EDTA, ethylene diamine tetraestic acid. EDTA chelate calcium and preserve cellular morphology, make it ideal for CBC. ഏതാണ് സി ബി സിക്ക് യൂസ് ചെയ്യുന്ന ആൻറ്റിക്കോയാഗുലൻ ഇ ഡി ടി ആണ്. ഇ ഡി ടി എന്താ കീലേറ്റ് ചെയ്യും കാൽസ്യത്തിന്, സെല്ലാർ മോർഫോളജിനെ പ്രിസർവ് ചെയ്യുന്നതുകൊണ്ടാണ് അത് യൂസ് ചെയ്യുന്നത്. ഓക്കെ. The presence of hypersegmented neutrophils is commonly seen in vitamin B12 deficiency. The normal range of hemoglobin in adult female 12 to 16 gram per dl. ESR increased in which condition? Inflammation. This stain is used to count reticulocyte supravital stain. What is the normal range, normal value of reticulocyte count in adults? 0.5 to 2.5%. Hence bodies are seen in G6PD deficiency. Which cell shows or roads myeloblast? The RBC morphology in iron deficiency anemia is microcytic and hypochromic. Which factor is essential for RBC maturation? Vitamin B12. Which method is used to measure ESR using Western Grand method? 1 hour. 1 hour ആണ് എടുക്കുക. ഓക്കെ. ESR സെഗ്മെൻറ്റ് ചെയ്യുക 1 hour. In sickle cell anemia, the amino acid substitution occurs at position 6. Valine replaces glutamic acid at the position 6 of beta globin chain. Okay. Valine replaces glutamic acid. Position എന്ന് പറയുന്നത് 6 ആണ്. ഓക്കെ. സിക്കിൾ സെൽ അനീമിയയിൽ പൊസിഷൻ 6. Which test is used to assess intrinsic pathway of coagulation? APTT. Hubble-Jolly bodies are remnants of nuclear DNA. Hubble-Jolly bodies, remnants of nuclear DNA, which is seen in asplenia. Okay. What is the dilution used for manual RBC count using a hemocytometer? 1:200. 1:200 dilution is the standard for RBC count using a Nuba chamber. The earliest recognizable cell in erythropoiesis is proerythroblast. Earliest recognizable cell in erythropoiesis is proerythroblast. Which RBC index is calculated using the formula Hp into 10 by RBC count MCHC, mean corpuscular hemoglobin concentration? Which of the following conditions shows Rowley's formation in peripheral smear multiple myeloma? Platelet satellitism is commonly seen in with which anticoagulant? EDTA, ethylene diamine tetraesteric acid. Answer is EDTA. Haematology bodies are commonly seen in patients with post-splenectomy in the case. Okay. The reference method for hemoglobin estimation is Steinmetz hemoglobin method. This is Steinmetz hemoglobin method. Reference method. Aplastic anemia is characterized by pancytopenia with hypocellular marrow. Pancytopenia with hypocellular marrow. Okay. In chronic myeloid leukemia, which genetic abnormality is characteristic? Philadelphia chromosome. What is the normal lifespan of a RBC? 120 days. Normal lifespan of RBC 120 days. Schizocytes on a peripheral smear are associated with microangiopathic hemolytic anemia. Which test is used to diagnose paroxysmal nocturnal hemoglobinuria? Flow cytometry for CD55, CD59. Okay. Which condition shows increased osmotic fragility of RBC? Hereditary spherocytosis. Teardrop cells are most commonly seen in myelofibrosis. Teardrop cells, myelofibrosis. Which stain is used for bone marrow iron stores? Prussian blue. The best test to differentiate between leukemioid reaction and CML is leukocyte alkaline phosphatase, LAP score. Which of the following is a microcytic hypochromic anemia, iron deficiency anemia? Coombs test is used to detect antibodies on RBCs. Which clotting factor is also known as Haematology factor? Factor 12. Haematology factor is factor 12. Okay. Haematology factor, factor 12. Basophilic stippling of RBC is seen in lead poisoning. Basophilic stippling of RBC is seen in lead poisoning. Reed-Steinberg cells are diagnosis of Hodgkin's lymphoma. Reed-Steinberg cells are diagnostic of Hodgkin's lymphoma. Normal platelet count is 1,50,000 to 4,50,000 per mm³. Okay. The confirmatory test for hemophilia A is factor 8 SA. Hemophilia A, factor 8 SA. Major hemoglobin in adults is HbA, alpha 2, beta 2. Okay. Which blood group is known as universal donor O negative? Universal donor is O negative group. Okay. Burst cells or echinocytes are commonly seen in uremia. Burst cells are commonly seen in uremia. Okay. The primary site of fetal hematopoiesis before birth is liver. Hematopoiesis primary site എന്ന് പറയുന്നത് liver ആണ് fetus. Okay. Which of the following causes a falsely low ESR polycythemia? Polycythemia വരേണ്ട കേസിലാണ് falsely low ESR കിട്ടുക. Okay. Which cell shows hairy cytoplasmic projection in perispermia? That is hairy cell leukemia. Hairy cell leukemia in the case. Okay. The test for fibrin degradation product is used in disseminated intravascular coagulation. Disseminated intravascular coagulation. Okay. Which vitamin is essential for synthesis of clotting factors 2, 7, 9 and 10? That is vitamin K. Hain's bodies are best visualized with which stain? Supravital stain. Hain's bodies visualize ചെയ്യുന്നത് supravital stain. Best visualize ചെയ്യുന്ന supravital stain. Which RBC index indicates variation in RBC size? RDW. Red cell distribution width. Hematocrit is defined as the percentage of packed RBCs in whole blood. Which of the following condition may show target cell thalassemia? Which anticoagulant is used for ESR in Westergren method? Sodium citrate 3.8%. Thanks for watching. Please like, share, comment and also subscribe my channel.